Hello, welcome to the NoiseFilter Show. My name is MarkAlain Dery. I'm an infectious diseases physician, and with me today is our co-host and producer, David Roston. And let's just jump right into it. Today, we're going to be talking about a major story shaking up the world of vaccines and of public health in America. On April 13th, the New York Times reported that Robert F. Kennedy Jr., now serving as the U.S. Secretary of Health and Human Services, is already making waves, but not in the way that many public health experts had hoped. Despite presenting himself as a vaccine advocate during his Senate confirmation hearings, Kennedy's actions since taking office are raising serious concerns about the future of immunizations in the United States. So let's start with what's changed. The NIH, under Kennedy's direction, has stopped funding research into vaccine hesitancy. Let me say that again. The NIH, which is our nation's most important scientific entity, under Kennedy's direction, has stopped funding research into vaccine hesitancy, research that was crucial for understanding why some people are reluctant to get vaccinated and how to address their concerns. Even more alarming is that the NIH has also canceled projects aimed at developing new vaccines to prevent future outbreaks. That means less innovation and fewer tools to fight the next pandemic. David, before I throw it to you, let me add real quick. The CDC, also one of our premier, in fact, one of the world's jewels in terms of infectious diseases and management of also chronic diseases, has also abandoned major promotional campaign for the flu vaccine. Kennedy has publicly cast doubt on the integrity of the CDC scientists, claiming that they have serious conflicts of interest. He used the word serious twice. They have serious conflicts of interest when it comes to vaccine recommendations. Public health experts warn that this kind of rhetoric can erode trust in vaccines, making it harder to maintain the high immunization rates needed to keep diseases like measles and polio at bay. David, thoughts?
Well, I'm curious to hear your perspectives on the immediate effects that you're seeing right now as the federal government is effectively taking away these vaccine efforts and putting it on the states. And you being in Louisiana, what you're seeing as an infectious disease doctor and talking about how this is already having an effect on people living in states that are effectively abandoning such mass vaccination efforts.
So the health commissioner for the state of Louisiana, literally moments after RFK was designated or confirmed as Secretary of Health and Human Services, released a statement that went to the Louisiana Department of Public Health. And in the statement, that was public, actually stated that from this point on, under the governorship of Jeff Landry, who is a red state Republican governor, I'll just keep it at that. From here on out, that the Department of Health is to no longer promote seasonal vaccines or to have vaccine drives. So I will remind everybody that prior to Decadence Weekend here in New Orleans, which happens over Labor Day weekend, it's Labor Day or Memorial? I always get them. It's Memorial.
Around Labor Day, yeah.
It's Labor Day. That's the fall, right? Labor Day is fall.
Right. Kind of end of summer.
End of summer. The 3-day weekend is a large gathering for the LGBT. The entirety of the Gulf South of the LGBT communities come out. Certainly everybody who's in the LGBT community, but really you have a large community from the LGBT. And it's a very 3 days of just pride and party and a lot of folks. And at that time in 2022, we were in midst of a Mpox outbreak, and what had happened was that in conjunction with the CDC, in conjunction with the Department of Health and the city health department, all got together and did a mass vaccination campaign that was wildly popular or wildly successful in terms of actually 1 month ahead of Decadence, because we were seeing Mpox starting to come through. We had multiple cases here in New Orleans. That mass vaccination campaign come decadence weekend, where we expected to see a super spreading event, we saw a zero spreading event because of that mass vaccination campaign. The vaccine prevented individuals from transmitting mpox from person to person. That was a wildly successful campaign, and to see the fact that we are unable to do this moving forward is problematic in this state.
Well, it's extremely distressing to hear that if we find ourselves in a similar situation going forward, where there's an epidemic like mpox facing the nation, or a pandemic, that we are essentially out of luck, and this
or bird flu
would be another topic.
That'll be many topics on this show.
Yeah. But it's quite scary, as in what I think COVID-19 showed us is that, this type of infectious disease preparedness is essential. And we are facing a world now without any armor, without any ammo in terms of protecting ourselves from the next big one. And yeah, it's quite scary.
So what's worse even is that the Department of Health and Human Services has also slashed, again, this is under RFK's leadership, has slashed billions of dollars from state health departments. These cuts directly impact programs that help upgrade childhood immunization systems and ensure vaccines reach the communities that need them most. In a recent televised discussion, Kennedy claimed that he was unaware of these cuts, despite widespread coverage and concern from state officials. So before you react to that, let me also add the FDA, and this is something that it cuts so deeply because it's so important. So at the FDA, a public meeting about flu vaccines was canceled and later held behind closed doors. So let me tell you about these vaccines. So these flu vaccines, essentially, they were supposed to happen somewhere at the beginning of the year. They were supposed to happen again sometime in March, and they'd been canceled. And it's at this meetings,
these meetings you're talking about, yeah,
these meetings where scientists, both government scientists, and we love our government scientists, thank you for all the work that you do, and public scientists or the private sector get together and they come up with what the formula is going to be for the next flu vaccine. And it's crazy that is no longer able to do. Ultimately, what ends up happening is that we're going to likely, and the pharmaceuticals are likely going to take their flu vaccines from what the WHO recommends. But even still, it cuts deeply because it just goes to show that this disregard for vaccines is going to be so impactful. And just even me just talking about my personal experience, like I'm in a hospital with a large amount of elderly individuals. In fact, all hospitals have elderly individuals. That's why they're, hospitals, people who are elderly end up in the hospital. And we see a lot of it with flu, with RSV, and with COVID. So the fact that these meetings are canceled is terrible. The review process for the new COVID vaccine from Novavax has also been halted. And Kennedy has even made the inaccurate claim that vaccines developed with similar methods don't protect against respiratory viruses, a statement that contradicts decades of scientific advance.
Yeah, it's this weird waffling of, if you're projecting that that the U.S. is eventually going to get this formula from the WHO after we've effectively left the WHO. So we are kind of posing as
and not funding.
And not funding, but taking from, and also saying that these vaccines aren't effective, but then no, maybe they are effective. You should get vaccinated. It's this dangerous communication strategy of going forward, of saying we don't want to do this. We believe that this is ineffective and a waste of money, and yet still keeping our toes in the water a little bit. It's dangerous, and also quite discombobulating to comprehend.
Yep. So just to kind of wrap this up, experts say that policy shifts like these can lead to lower vaccination rates and more outbreaks of preventable diseases and a loss of public confidence in one of medicine's greatest achievements. The CDC's own data shows that when people lose trust in vaccines, coverage drops and diseases we thought that were once under control can come roaring back. And I just like to remind everybody that some of the main reasons why we as human beings are able to live beyond 40, 50 to expected age rates of 70 and 80 years old are largely to two things, which is clean water and plumbing and vaccines. Right. And the fact that we are going to lose the vaccines element or a major part of it, or it's going to be significantly hampered. I think in the next 5 to 10 years, we're going to see a very different country and society within the US with respect to vaccine preventable deaths and the vaccines that children or the diseases that children are going to suffer, like we're seeing right now with measles. We're going to likely see with other things that we thought were long gone. Chief among them is going to be polio.
Yeah. All these efforts that we've undergone over decades feel like they're just going to be squandered, as we can just see as we're just not doing our due diligence to protect young people and elderly folks from very preventable deaths. It's quite distressing. So, yeah. Anything else to end on?
I just need to let everybody know, speaking on behalf of medical professionals all over the world, vaccines remain safe, effective, and are essential for protecting our communities.
Amen. Thanks for watching NoiseFilter Show, and
subscribe and like this video. Leave a comment below. It helps the algorithms.